I'm Dr. Farhana Masood. A brief introduction and report of Women's Self-Care, PIMA. Women's Health Project is the project of PIMA, Women Wing, which aims to raise awareness among Pakistani women about the highly prevalent cancer of cervix and breast. Next. Our vision is to become a nationwide NGO that will contribute significantly to the decrease of cancer-related morbidities and mortality among Pakistani women achieved by promoting early detection and ensuring access to effective treatment, to foster the union and collaboration of all NGOs involved in this issue. Our vision is a society in which there is early diagnosis of these two cancers so as to prolong survival and provide better quality of life. Mission is to strive to seek the pleasure of Allah by alleviating the miseries of breast and cervical cancer in Pakistan. These are our two bookmarks: Breast and Cervical Cancer Awareness Campaign, Show Your Care and Be Aware, Jald Tashkhees Behreen Ilaj. Next. So our activities are empowering communities through knowledge, on-site and online programs, social media messages and engagement, multilingual brochures, training of the healthcare providers, establish a system for screening, guidance, and prompt referral to specialists, and also support system, collaboration with organizations and institutes. So these are our slogans: for every fight won, for each battle lost, for all those who are still fighting, I proudly wear teal and white. Supporting the fighters, admiring the survivors, honoring the taken, and never ever giving hope. These are our slogans. Next. Early detection saves life. Cancer doesn't wait, let's act now. Next. Get informed, get screened, get vaccinated. Cervical cancer be prevented and treated if caught early. So this is a brief report. This project was formed in 2011 and to 2024. This is a brief report. And initially we just made plannings and capacity building, then on-site online programs of training of healthcare providers, and participants were over 2,000. Awareness programs on-site 55, and participant over 5,000. And this is a lecture given by our doctor in Civil Hospital, Hyderabad. And this is our brochure. Jald Tashkhees mein apna hissa daliye. Next. Screening and guidance of breast cancer and cervical cancers in different hospitals. Next. Capacity building, we IT workshops. We organized an IT workshop, project management workshop, team members meeting, and meetings with other organizations just like Easy Shifa and Cancer Foundation Hospital. Together we rise to fight against cancers. This program was held in JSMU, in which following topics were approached: approaching the patient with breast complaints, breast examination and self and clinical, breaking the bad news. These were our topics, and Dr. Sareen Naza was our chief guest. Next. This is JSMU. A workshop is being held on cervical cancer and on breast cancer. Next slide. This Women Health Seminar was held in Bahawalpur and Multan, where diverse audience were present, healthcare providers and mothers also, and students. Next. इब्तिदाई मराहिल में तशखीस, छाती कैंसर जितनी जल्दी तशखीस कर लिया जाए उतनी ही सेहतयाबी के इम्कानात ज़्यादा होते हैं। छातियों का वक्तन मुआयना खुद करें, छातियों का एक्सरे यानी मेमोग्राफी करें, छातियों का अल्ट्रासाउंड करें. This is our message to the public. These are our brochures: breast cancer, छाती का सरतान, introduction of Women's Health Care Project, and cervical cancer introduction for the public. Next. A survey was conducted in the female population of Karachi to assess the awareness of knowledge of breast cancer, and the paper was published in Annals of Abbasi Shaheed Hospital Yani we did a survey on the female population. Next. Dream for a better future, treat the patient with love and care, hope for the best, faith in Allah subhanahu wa ta'ala, and strength to bear the disease. So slogan is show your care, be aware, early detection is the best protection. PIMA welcomes your physical, financial, and moral support. This was all about Women's Health Care Project. And the next project is SOCH, Safe Obstetrics and Child Health. Next slide. Safe Obstetrics and Child Health, SOCH. This is another project of PIMA. Next. Pakistan has the third highest burden of maternal mortality and sixth highest burden of perinatal infant mortality across the globe. So what is SOCH? Safe Obstetrics and Child Health. It's a project. Previous slide, please. The vision of this project is to address and fulfill the needs for mother and child health. Next. Goals and mission: reduction in maternal mortality rate, postnatal mortality rate, infant mortality rate, and childhood morbidity and mortality. Ensure safe and skilled healthcare during pregnancy and childbirth and postnatal period at all Al-Khidmat healthcare facilities and also other hospitals. Safe and effective vaccination, prevention and management of anemia and malnutrition in children in VETEC schools and also other schools. Capacity building and skill drills of healthcare providers. SOCH aims for healthcare provider safety against infection, litigation, and violence. Next, what's the health status of Pakistan? All our rates, infant mortality rate, maternal mortality rate, and postnatal mortality rate are higher than India, Bangladesh, and Sri Lanka. Infants and newborn die mainly due to birth asphyxia, IUGR, acute respiratory tract infections, early neonatal death and prematurity. Majority of the maternal deaths are hemorrhage, puerperal sepsis, hypertensive disorders of pregnancy. Pakistan is the third among countries with the most unvaccinated, under-vaccinated children. So are these adverse outcomes preventable? This is a question which should be asked. Next. So these are our goals. By 2030, no poverty, zero hunger, good health and well-being, quality education, and clean water, decent work and economic growth, good innovation and infrastructures, reduced inequalities, and clean climate, life below water, life on land, peace and justice and strong institutions, sustainable cities and accommodations, responsible consumption and production, and also peace and justice and strong institutions, partnership for the goals. These are sustainable goals. So the activities are capacity building and skill drills to ensure the competence of professionals, and CME activities and regular obstetric drills, evidence-based guidelines, SOPs and hospital policies at all healthcare facilities. Next. Training of the community midwives and deployment in community to provide MNCH service, increased delivery rate by skilled birth attendant, capacity building and skill drills of family physician and obstetrician. Government should support infant nutrition by reducing marketing practices of infant formula through national legislation. Next. Strengthening family and communities, enhance nutritional service for mother and child at community and facility levels, educate nutrition during pregnancy is critical to reduce the incidence of low birth weight and to improve long-term childhood development. Enhance comprehensive breast-spacing service within the bounds of Islam at community and facility level. Next. So in the infections, we have to prevent infection to save lives. This includes hand hygiene, cleaning and disinfection, vaccination, personal protective equipment, injection safety. Next. Key elements of effective infection control programs, standard precautions, immunization, waste management, cleaning and disinfection, safe use of sharps, personal protective equipment, hand respiratory hygiene, training. Next, waste management. Safety management, disposal of this waste is crucial to prevent from serious public health consequences and to protect environment. And there are many types of waste: non-clinical waste, infectious waste, radioactive waste, chemical waste, pathological waste, sharps, and pharmaceutical waste. Types of healthcare waste. Next. So a brief report on the 2 years activity of SOCH, 2022 and 2024. Next. So training of the healthcare providers on safe of practices. Mother and care health centers were visited in Sindh and Balochistan, and 40 participants were there, and healthcare provider attended the awareness program. Awareness given during visit of Central President to Lahore, and a strategic planning meeting held in office of Professor of Hematology, Thalassemia Center in Lahore was visited. Next. Expert taught on OPS in SERM International Conference, session on breastfeeding in Railway Hospital, Rawalpindi, talk on risk assessment in labor safe obstetrics in Abba Hospital, Faisalabad, skill drill in Nazmabad Hospital, Karachi. Next. This is a short review because of time constraints. Kangaroo mother care and expert talk, seminar on SOCH in social security teaching hospitals, women win projects, WSP and SOCH organized seminars in Bahawalpur and Multan separately for healthcare providers. All programs were attended by diverse audience and students, pharmacists, physiotherapists, lab practitioners, nurse, working women, housewives, students. Regular training program in Rawalpindi on early neonatal resuscitation and breastfeeding. Next. These are all our activities which has been placed in the last 2 years. A meeting with central in charge from Karachi. Initial pilot in Lahore, 3 schools was agreed upon and started. Camp for screening in Batak school. Mothers were given awareness talk on Islamic guidelines to how to raise children and on Islamic principles of health and hygiene. A very successful workshop was conducted in Civil Hospital, Thatta, Makli. Next. So this was the invitation of ensuring safe pregnancy in Social Security Hospital, Faisalabad. Next. Thank you. A short report about women's healthcare and SOCH.